I'd like to introduce new guidance from the Royal College of Radiologists on the use of patient images which are obtained as part of standard of care but used for teaching, training or research. We're very grateful that we were able to bring together guidance from radiological and legal expertise as well as patients and members of the general public. We've written the guidance because we've become aware that sharing patient data presents immense opportunities for improving patient care and patient outcomes. Guidance on how to use this data comes from a variety of sources, such as the GMC, the Information Commissioner's Office and the National Data Guardian for Health and Care. However, what this document aims to do is to bring together the guidance in an accessible format tailored to radiology. It's essential that we get this right because although data sharing has immense potential to improve patient care, it's equally important that patient trust is maintained. The document outlines 3 distinct categories of data. The first is identifiable patient data, and that can also be known as personal confidential information. This is data that can identify a patient either directly through their name or indirectly by revealing a combination of information that could be used to identify someone, such as a hospital name plus patient number. Patients must be consented for this type of data to be used. The second type of data is de-identified data for limited access, also known as pseudo-anonymised data. For example, an NHS researcher may replace all patient identifiers with a research code number to share the data with a researcher at another NHS institution. This sort of data sharing can be performed without consent, but all organisations must have appropriate data stewardship arrangements, such as strict organisational controls and named responsible individuals. The third category of data is data that is de-identified to the point of publication. And as the name implies, this is data that does not contain either direct or indirect identifiers. And this data can be used without patient consent, but there should be no reasonable prospect of the patient being identified. We hope that you find this document useful and that it will facilitate data sharing for patient benefit.